What is a root canal? Root canal is kind of a dirty word in dentistry. The truth is that in modern dentistry, root canals generally are easy procedures that can be pain-free and really simple way to rescue a tooth that's infected and not a candidate for just a simple filling or something like that. Inside each tooth, we have a small canal or chamber where a blood vessel and a nerve is housed, and this is what gives the tooth its life force. We call this area of the tooth the pulp, and that euphemism is basically because the texture of the inside of the tooth is a lot like the pulp of a fruit. It's a little bit softer and mushy, and this is where the life comes to the tooth. But the challenge for this is that when bacteria is crawling slowly through your teeth, creating a cavity, it's moving generally very slow as it's chewing through the calcium and softening the tooth. When it hits that pulp chamber or that soft area of the tooth, the bacteria can basically spread very freely up and down the length of the tooth and end up kind of up into the jawbone or down below into the jawbone, creating an abscess or infection. Now, sometimes teeth that have this infected pulp chamber don't become inflamed or cause pain, and the tooth essentially dies and lays dormant in the mouth, and this can exist like this often for years. Sometimes this process can be painful. Patients that are experiencing a classic toothache symptoms often have inflammation in this pulp chamber. When we bump or hit, say, our arm and create swelling, we get a bruise and some swelling. Our skin stretches to accommodate this. But if you think about swelling on the inside of the tooth, there's nowhere for that swelling to go but inward, and this pressure or squeezing on the nerve of the tooth is what creates the tremendous sense of pain that patients have when they have a classic toothache. When we have these types of pain symptoms or infections, these are non-reversible problems. Things like antibiotics are not capable of killing the infection on the inside of a tooth, and so the only way to alleviate this type of problem is to go in and actually clean out the infected tissue. So the inside of the tooth, this small little pulp chamber, is basically a little canal that runs from the crown or upper area of the tooth all the way down through the length of the root. And a root canal procedure is essentially just a really deep filling. A small access opening is put into the tooth to allow us to see that pulp chamber, and a series of really small files that are threaded like a little drill bit are kind of spun around by hand in order to clean or excavate that soft pulp tissue. And as this infected tissue is removed, some chemicals like medical grade bleaches and other things are used to sterilize the internal surface of the tooth. And then a natural rubberized material that we call gutta percha is placed into the tooth to kind of seal and close everything to prevent new infection. Most of the discomfort associated with root canals comes from the pain that a patient is in before the root canal happens. If a patient says that they had a bad experience with a root canal, generally they're in a lot of pain before the procedure, and it's just a question of getting them out of pain, and that process can obviously be a little overwhelming. If you have a tooth that is what we call asymptomatic, meaning it's not in pain, generally root canal procedure is really, really easy for the patient, and the cleaning and excavating of this tissue can be pretty simple. Sometimes we can identify small abscesses or infections below teeth in x-rays. Other times patients are reporting discomfort when they're chewing or biting, maybe prolonged hot or cold sensitivity that can all lend us clues about problems on the inside of a tooth that maybe we can or cannot see in an x-ray. So if you're having a problem in a tooth that doesn't feel quite right, your dentist is likely to perform a series of tests on the tooth. Those tests would start with likely an x-ray, a visual inspection. Oftentimes the dentist will tap or create percussion on the tooth to get clues about what's happening both inside the tooth and underneath in the jawbone. Sometimes the dentist will even perform something called a cold simulation test, which involves placing small amount of cold solution on the tooth to try and elicit a response. And depending on how long that tooth feels cold, we can learn things about what's happening on the inside of the tooth that we couldn't just by looking at it. A lot of times advanced dental techniques allow for things like electronic pulp testing, which is essentially using small bits of electricity to diagnose whether a tooth is living or dead or dying or not. So all of these techniques can be used to help us identify what tooth is the problem and what the problem is, and that helps us land in a proper treatment scenario. So if you are a candidate for a root canal procedure, make sure you ask some questions of your dentist in terms of, what is the diagnosis, why are we doing this, and what is the prognosis, meaning what's the likelihood that this is successful. Now in dentistry that we have implant therapy, there can be a tendency for people to kind of want to skip the root canal and go right to the implant therapy. And sometimes this is indicated, but the survivability and predictability of a properly root canal treated tooth is really, really great. Literature shows survival rates in the high 90s, 10 years out from root canal therapy if we properly crown and cover a tooth after the treatment. And so a tooth that needs a root canal oftentimes can be something that you keep around for a very long time after the treatment is completed. So make sure that you have all the information you need so that you are making the choice that makes most sense for you and matches your expectations. If you are investing in a treatment and your expectation is that it lasts a certain amount of time, then you need to have an honest conversation with your dentist and express that, because if they don't share those expectations, it might be reason to pivot and reevaluate, consider other treatment options, or just allow you to go into a treatment protocol kind of with your eyes open so that you're not surprised. If you have a problem down the road, it's not jumping up and catching you when you don't expect it. So ask a lot of questions and make sure that you have all the information you need so that the treatment choices you land on match your reality, your expectations for time, cost, and prognosis. And when those types of things happen, we see great treatment outcomes because nothing surprises us.